Hey everyone, welcome back to the YouTube channel MEDICO'Z Factory. So we will continue series of hernia. So in today's lecture, we will discuss about inguinal hernia in detail. All the content are provided here, keeping in mind the student's requirement. You can subscribe the channel for more such content. So let's begin. Surgical anatomy of inguinal canal. Superficial inguinal ring is triangular opening in the external oblique aponeurosis and is 1.20 cm above the pubic tubercle. The ring is bounded by a superior, medial, and inferolateral crus. Normally, the ring does not or just admit the tip of little finger, as you can see in the diagram. Deep inguinal ring is U-shaped. Condensation of the transversalis fascia lies 1.20 cm above the inguinal ligament. Inguinal ligament, it is formed by the lower border of the external oblique aponeurosis, which is thickened and folded backward on itself, extending from anterosuperior iliac spine to pubic tubercle. Inguinal canal, it is an oblique passage in lower part of abdominal wall, 4 cm long, situated above the medial half of inguinal ligament, extending from deep inguinal ring to superficial inguinal ring. It starts from the internal inguinal orifice, extends medially and inferiorly through the abdominal wall layers and ends in the external inguinal orifice. In infants, both superficial and deep rings are superimposed without any obliquity of the inguinal canal. Inguinal canal in female is called as canal of Nock. It is important, do remember this. Now the content of inguinal canal. Spermatic cord in males, round ligament in females, and ilioinguinal nerve. Now the contents of spermatic cord. First is vas deferens, then artery to vas, testicular and cremaster artery, genital branch of genitofemoral nerve, and pampiniform plexus of veins. This is ilioinguinal nerve. This is internal spermatic fascia, cremasteric fascia with muscle, and artery of deferens. This is important diagram. Next is remains of processus vaginalis, sympathetic plexus around the artery to vas, internal spermatic fascia from fascia transversalis, cremasteric fascia, external spermatic fascia from external oblique aponeurosis is seen below the external ring in the scrotum. Okay. Now the boundaries. In front, external oblique aponeurosis and conjoint muscle laterally. Behind, inferior epigastric artery, fascia transversalis, and conjoint tendon. Above, conjoint muscle, and below, inguinal ligament, as you can see in the diagram. Now the defense mechanism of inguinal canal. Obliquity of inguinal canal, that is the two inguinal rings do not lie opposite to each other. Therefore, when the intra-abdominal pressure rises, the anterior and posterior wall of the canal are approximated, thus obliterating the passage. This is known as the flap valve mechanism. Next is Sutter mechanism of internal oblique. When the arcuate fibers of the internal oblique and transverse abdominalis muscle contract, they straighten out and move closer to the inguinal ligament, as you can see in the diagram. Now the arching of conjoint tendon. It is located in the inferior abdomen and is formed from the common aponeurosis of the internal oblique muscle and transverse abdominis muscle, although they can be separated. The fibers turn inferiorly and insert into the crest of the pubis at the pectineal line. as you can see in the figure. This is pectineal line. Immediately deep to the superficial inguinal ring. Medially, the fiber of the conjoint tendon fuse with the anterior wall of the rectus sheath, while laterally the fibers may fuse with the interfoilar ligament. The conjoint tendon makes up the main part of the medial portion of the posterior wall of the inguinal canal. Next is ball valve mechanism due to contraction of cremaster muscle which plugs to superficial ring. When external oblique muscle contracts, intercrural fibers of the superficial ring oppose causing slit valve mechanism. And next is hormones. Now next is Frachaud's myopectineal orifice. It is an osteomyoepineurotic tunnel. It is through this tunnel all growing hernias occur. It is bounded by medially by lateral border of rectus sheath, above by the arch fiber of internal oblique and transverse abdominalis muscle, laterally by iliopsoas muscle, and below by the pecten pubis and fascia covering it. Okay, so that's it. We will discuss about classification of inguinal hernia in the next lecture. There will be three parts. First, which is earlier classification, second is according to extent, and third is the latest. So do subscribe the channel to learn together and share the video with your friends. And in case of any doubt, use comment section. Have a nice day. Bye bye.